raise your hand if you ever heard that cholesterol's bad. And you got to get it low in your blood. You got to have a low cholesterol diet, otherwise you're going to get heart disease, right? Doctors would like to blame all cardiovascular disease on cholesterol. We've known for 75 years in the animal industry that cholesterol is not a boogeyman. There's not a single disease that's caused by elevated blood cholesterol or triglycerides. If you can find me one, I'll give you $1 million in small bills in any offshore account you want. There's not a single disease that's caused by elevated blood cholesterol or triglycerides. Elevated blood cholesterol and triglycerides are really just a warning signal, much like a fever. Fevers don't cause infections, but when you have an infection with a bacteria, a virus, a fungus, maybe a parasite, you can get a fever. You can have a broken leg and get a fever. You can have cancer and get a fever. You can have liver disease and get a fever. Babies get a fever when they teethe. And so you have to kind of sort it out. When somebody comes into a doctor's office with a fever, you have to say, well, okay, here's my whole list called a differential diagnosis, all the things that cause fever. If they're 80 years old, you can quickly rule out teething, right? But the rest of them, you may have to do some lab tests for them. At any rate, the same thing is true for elevated blood cholesterol and triglycerides. When you have elevated blood cholesterol and triglycerides, it might mean that you have hypothyroidism or low-functioning thyroid gland. You could have diabetes. You could have deficiencies of niacin, chromium, vanadium, the essential fatty acids. You could have liver disease. All kinds of reasons why you might have elevated blood cholesterol and triglycerides, but they in themselves don't cause any problems. Now, the Eskimos above the Arctic Circle have a traditional diet that's 98% red meat and blubber. They eat whale meat, whale blubber, walrus meat, walrus blubber, seal meat, seal blubber, bear meat, bear fat. There's not a single Eskimo above the Arctic Circle that has a Mr. Juice Man juice or eats organically grown broccoli. Their average cholesterol ranges from 250 to 350, and yet they're legendary for not getting cardiovascular disease until they come down to the lower 48 and eat like us. Then when they get the cardiovascular disease, they go back home to die up above the Arctic Circle. They start eating whale blubber again, and it goes away. Well, learning all that, I felt very confident in telling my patients, look, we're going to do something different. My goal as a physician is to have my patients die at an average age of 100. I don't want my patients dying at 75.5. I want to give them another 25 years. I want the average lifespan for my patients to be 100. And we're going to do something different. If you want to do everything that all the other doctors and patients are doing, I want you to go to them because I don't want you to lower my average, right? We're going to do something different. It's just real simple.